And representing the Kentucky Nurses Association, Dewey Parker. I just want to tell all of the speakers, this is a recording device. It's not a microphone, so we just have to speak loud.
Okay. I don't think we're near enough excited about this issue. I think let everyone in this neighborhood know how we feel. Yeah. Repeat after me. As loud as you can. Say, I'm sick.
I'm sick.
When I hear about lobbyists in Washington that drop big loads of money to fight health care, to fight prescription drugs for our seniors, all those issues in Washington, I get sick. When I hear about hundreds of thousands of Americans that do not have health care, many of those that are children, I get sick. When I find out that nurses have trouble giving IVs because they get needles from the lowest bidder at the hospital, I get sick. When I find out that nurses have extremely high ratios and cannot take care of patients properly, and they're suffering the burden of health care at the hospital, I get sick. If we don't get all of America out to see this movie, it's going to make me sick. Thank you.
Thank you so much, Michael Moore. We've been needing this for a long time. Health care, not managed money.
Michael Moore, thank you again for bringing an issue to the general masses so that we can really get something moving on this issue. Health care reform for all. Thank you.
Hi, Michael Moore. Thanks so much. We're ready to see SiCKO and get into action. Thanks again.
Michael, we want to thank you with all our hearts. Once again, you're a winner.
I think we all have a lot to be grateful to Michael Moore for. This movie about the healthcare crisis in the United States couldn't be coming at a better time.
Hey, Michael, thanks so much for having the guts to be somebody who speaks out for Americans and their rights for a national health care program.
Michael Moore, I want to thank you for making this movie and giving us the opportunity to talk about single-payer national health insurance. Hopefully we'll see something that'll change in the next few months.
As someone who actually lived under single-payer plans in Sweden and England, I can tell you they work very efficiently, effectively, and cover everybody. They're great plans. Thank you, Michael Moore, for educating the American public.
And now I'd like to ask Martin Meyer, who is the health representative for our congressman from the 3rd District, John Yarmouth. John is in Washington now and could not be here, but he designated Marty Meyer to please come and say a few words.
Thank you all very much. I just want to say first of all that there is nothing more effective to change the laws of this nation than a small group of passionate and determined people. And this is our poster child for that person right here with Dr. Adams.
This is a song about managed care. We will fight, protect patients' rights. We're only here to please. But don't get sick. You'll find out real quick. We don't cover your disease. We don't cover your disease.
Hey, Michael Moore, thanks for doing this film. You are the best. Don't let them get you down. We're going to get them this time. HR 676. Thank you.
Thank you, Mr. Moore, for providing us with this wonderful opportunity to spread the word about the healthcare industry in Kentucky. You've done such great work on other important issues, and we're going to use this as a tool in Kentucky to make change. Thank you so much.
Thank you, Michael Moore. We're looking forward to seeing SiCKO, and keep up the good work. Thanks.
Next, it's my pleasure to introduce the president of the Kentucky AFL-CIO, Bill Lundrigan.
Thank you, thank you, thank you, thank you. Well, it's great to be out here with everybody on this very critical issue. And let me just refer to what Michael Moore said was the prescription for our disastrous healthcare industry. He has 3 things that he's put on his website. He says every resident of the United States must have free, universal health care for life. All health insurance companies must be abolished. Pharmaceutical companies must be strictly regulated like they are a public utility. Now, how much plainer can it be for folks not to get the message that this whole issue is based on greed? based on the profit motive as opposed to the healthcare motive, or treating people of this country with dignity and respect. Now, we're all here together to raise our voices. If you go to Michael Moore's website on SiCKO, you will see a number of activities that can be undertaken, including contacting your representatives, writing op-eds, and doing other public activities, because the message here today is that if we raise this issue and enough Americans realize what a SiCKO healthcare system we have, it will be changed. Thank you very much.
Hey, Michael Moore, thanks for the movie. Everybody in, nobody out. Let's take people over profits. Let's do it now.